So our book, Seeking Value, the Balance of Cost and Quality in Psychiatric Care, um, came about as a result of conversations we had with our Mental Health Services Committee of the Group for the Advancement of Psychiatry. And over the past decade, actually, we have had various conversations about um, issues within our broad mandate of mental health services. And it started to become clear that many of these topics are related to the value of the services that we provide. And what we mean by value is sort of a product of quality over cost. So, the United States, in the United States, and our sort of fragmented system of care, we spend a lot of money for very poor results. And as we began looking into this, the United States spends probably twice as much, about twice as much, on healthcare as any other developed nation. We're up around 20% of GDP. And ironically, our outcomes are poorer than most nations by a good margin. And we look, there's a variety of indicators that we look at to make that determination, which I won't go into at this point. But in any case, so we started just thinking about that and how psychiatric care, how mental health plays into that picture. So as we thought about this, we wanted to figure out some way to pull all these issues together that affect quality. And so we came up with the idea for this book, which looks at value and how it is undermined, and also strategies that we can use to better the outcomes that we get, and actually probably decrease the cost of the care that we provide. So we begin by looking at the evolution of healthcare financing and quality control, and taking a look at how we compare to other developed nations. And part of that is looking at the many factors that undermine value, our neglect of some of the social determinants of healthcare, the waste that is part of our system and the way that it is arranged, the fact that our services to a large extent are profit driven and businesses, as opposed to what we often talk about as a human right to healthcare. And the lack of universal coverage is another big contributor. So we kind of take a look at that. And then the next part of the book is starting to look at solutions. So it begins by looking at some of the ways that we can change systems to better take advantage of the resources that we have available. And then moves on to a consideration of how we can affect value on a professional level. And that includes how psychiatrists can manage their resources and their awareness of the expense of treatment versus the outcomes that we get, and do a better job of that. And so we look at prescribing practices, we look at some of the issues surrounding diagnosis. We begin to look at leadership and advocacy and psychiatry's role in those activities. So as well as changes in the system of financing and how financing can actually incentivize services that give us greater value. And then in a final section, we look at some of the global issues that we don't normally think of as health related or mental health related, or at least not everybody does. And so we look at things like climate change, our incarceration practices, the mental health issues and how they're dealt with in the workplace. To name just a few, how we deal with people at the end of their lives, and how we create better outcomes in all those areas. So that's the general premise of the book. And it's really intended for a fairly broad audience. The title is actually seems specific to psychiatry, but it is really much broader than that and entails healthcare reform in general, because one of the points that we really emphasize is that there is no healthcare without mental health care, and that the impact of mental health on the health of society, on public health, is really critical to the overall health of our population. So, if we neglect mental health, obviously healthcare is going to suffer. But many of the reforms that are needed to improve the public health outcomes of our health system really are system-wide and need to be considered in an integrated way. And obviously that is in tune with the new emphasis on integrated care in our profession. So these are many of the reasons that we developed this book, and that we think will be valuable to everybody in our profession and in medicine in general. So we hope that you will have an opportunity to take a look at it, and we would certainly love to hear your feedback.